AMT. Innovating, educating, changing lives. Welcome to the AMT Bridle Pro educational training tool. We're going to show you how to secure your patient's nasal tubes with the AMT Bridle Pro system. Critically ill patients depend on consistent nutritional management. The AMT Bridle Pro device dramatically reduces nasal feeding tube pullouts, resulting in an improved caloric intake and reduced cost. We'll go step by step, showing you proper techniques and placement. The AMT Bridle Pro system is available in a wide variety of sizes to accommodate both pediatric and adult populations based on the French size of the nasal tube. The AMT Bridle Pro system consists of a retrieval probe, a flexible monofilament bridle catheter, which houses a removable stylet guide, a pre-attached clip opening device, and a packet of water-soluble lubricant. The main portion of the kit, the probe and bridle catheter, have tiny but powerful magnets at their tips and are integral to making the connection between the two pieces. However, after proper placement, the AMT Bridle Pro is MR safe. The AMT Bridle Pro nasal tube retaining system was developed to avoid the high costs of nasal tube pullouts, while simultaneously improving patient outcomes. The AMT Bridle Pro is easily placed by passing magnets within the nasopharynx to draw the flexible bridle catheter through one nare around the vomer bone and out the opposite nare. The flexible bridle catheter is then anchored to the nasal tube with the pre-attached AMT Bridle Pro clip. The vomer bone is a mid-skull bone forming part of the nasal septum. The vomer bone begins formation at 8 weeks gestation, is fully formed as bone by 18.5 weeks gestation, and is ossified at birth. The AMT Bridle Pro is FDA cleared for patients of all ages. Consistent nutrition plays an important role in the management of nutritional deficiencies and is part of the standard of care for critically ill patients. The AMT Bridle Pro system dramatically reduces feeding tube pullouts, resulting in an improved caloric intake. The AMT Bridle Pro system is cleared by the FDA for use with both pediatric and adult patients for 30 days of continuous use. It can be used with any brand of nasal tube. Less pullouts results in significant savings for both the caregiver and patient. Caregivers save by avoiding the cost of additional supplies, medication, radiology, and also save time by avoiding repetitive procedures. Patients also benefit from these reduced costs and number of procedures. With the AMT Bridle Pro, there are several new elements in our system, including new tubing, the Pro Clip, and the Pro Range Clip. With our Pro Clip, we offer a wide variety of French size specific adult sizes, from 8 French to 18 French, even accommodating the large Salem sump tubes. The Pro Range Clip can accommodate more than one French size for feeding tubes. It's available in 5 to 6 French and 8 to 10 French. It also increases patient comfort and ease of use for healthcare providers. The rigid inner portion of the clip is strong, secure, and easy to close. The soft, over-molded portion increases patient comfort, especially in pediatric patients. Before beginning the placement of the AMT Bridle Pro, it's recommended to have the patient in a supine position. With the AMT Bridle Pro model, lubrication is no longer necessary, but lubricant or water may be used if desired. The AMT Bridle Pro may be placed before or after the nasal tube, except in the case of pediatric patients, in which the Bridle Pro is recommended to be placed prior to the nasal tube. Begin the procedure by inserting the probe into the nostril, opposite of the nasal tube, along the floor of the nostril. Do not insert upwards towards the patient's eyes. Continue until the first rib reaches the bottom of the nostril. Next, insert the AMT Bridle Pro tubing with removable stylet into the opposite nostril to approximate the magnets. Pull back the orange stylet about 1 centimeter to connect the magnets. This may result in an audible click that may also be felt. If you're having trouble getting the magnets to connect, it may be beneficial to have the depth indicator markings line up together. If issues with connection continue, gently twist the probe side to side and up and down to encourage the connection. If with the aforementioned method no contact has occurred, advance both the flexible bridle catheter and the probe. Once contact has been achieved, remove the orange stylet completely from the bridle catheter. Slowly withdraw the probe and allow the bridle catheter to advance through the nose. Continue until the 2 black markings on the bridle catheter are completely pulled up and through one nostril and at least a couple inches outside the opposite nostril. This creates a loop, or bridle, around the vomer bone. Cut and dispose of the bridle tube section containing the magnet and black markings, and dispose of the blue probe. If not already done, insert the nasal tube per the manufacturer's instructions. Wipe down the feeding tube and bridle catheter if necessary. Slide the clip up the AMT Bridle Pro tubing to approximately 1 centimeter, or alternatively 1 finger width, from the nostril. Then place the nasal tube into the clip's defined nasal tube region. For the Pro range clip, 5 to 6 French and 8 to 10 French, ensure the nasal tube fits securely. Place loose strand of bridle catheter between the clear flats below the circular region of the clip. For the Pro clip 8, 10, and 12 French, ensure the nasal tube fits securely in channel. Place loose strand of bridle catheter in the clip's hinge. Finally, for the Pro clip 14, 16, and 18 French, ensure the nasal tube fits securely in the channel. Place loose strand of bridle catheter between the softer inner portion of the clip and the outer, more rigid plastic section. Close the clip by folding over the plastic edge and firmly snapping it closed. While holding the tube fixed, gently pull on the bridle catheter ends to verify the clip is closed. Once you've ensured the clip is closed, tie the 2 strands of bridle catheter together into a simple knot below the clip. You may then cut the excess bridle catheter 1 centimeter below the knot. If the clip must be opened, use the clip opening tool. Slide the opening tool into the clasp of the clip and then turn slightly to open. The AMT Bridle Pro is recommended for 30 days continuous use. When it comes time to remove only the AMT Bridle Pro device, cut one side of the bridle catheter and open the clip. Gently pull on the opened clip to remove the bridle catheter from the nose. For removal of both the AMT Bridle Pro device and feeding tube, cut one strand of the bridle catheter, gently pull both the AMT Bridle Pro and the nasal tube out of the nose. Thank you for watching.